be the Prone ILA Exam 342. And this has two components to it, and I mentioned this to you already. So you're just going to first assess in neutral position. Come down a little bit more so your feet are hanging off the edge. Okay, I'm just going to lower your drawstring a little bit. Thanks. So the easiest way I find to find where I am on the ILAs is I find first the PSIS. I'll come to the midline, and then I'll follow the midline down until I get to the sacral hiatus. Okay. At that point, I'm in midline in the sacrum. I'm now going to come off the sacral hiatus and go laterally until I feel the prominences of the ILAs. The thing that I need to look for with the ILAs is I need to examine them for their position in the coronal plane, in the plane underneath my thumbs. So I want to see their coronal orientation. Okay. So I want to make sure that the left and the right are equal. The other part to the ILA exam, and this is where you're going to end up finding your unilaterals, is you're going to now sync on the inferior aspect of the ILA. Okay. So the inferior aspect, kind of hard to catch that on.
If you drop maybe your right forearm the other way.
Okay. So instead of being on the posterior aspect, I'm now on the inferior aspect. And what I want to do here is I want to check for levelness. Because what did we say about the unilaterals? It's either going to be sheared down or sheared up. The torsions really aren't going to differ so much in this assessment of palpation. But the shears will. And that's the spot, that's the magic assessment tool that you're using to define your sacral unilaterals. Okay. So again, finding the ILAs midway down, sacral hiatus, come out to the ILAs, assess for symmetry in the coronal plane, then drop under the ILAs and assess for leveling left and right, or symmetry. Okay. And then the final thing that I'll have you look at when you break is coming up and looking at the sacral basis. Okay. The way that you're going to do that is on the PSIS, and that should actually be number 28. Mm-hmm. So we went 26 to 31, 27, 28. And here what you do is you make contact on your PSIS. To get to the sacral base, you need to come a little bit medial and a little bit superior. It's about a 30-degree angle. And what you're going to do is you're going to assess for the depth of your thumb to locate the sacral base. Ideally, you want it to be symmetric. One sacral base may be deeper, and they refer to that space that I'm palpating is called the sacral sulcus. So the osteopaths are curious about knowing the depth of the sacral sulcus. If in this neutral position, I find that the right sacral sulcus or the right sacral base, the sulcus is deeper, and I have to make the assumption that that sacral base is a bit forward. But at that point, I only know that because I haven't challenged it with motion. I don't know if it's more forward because the other one is back more until I either have the patient flex or extend. And we're going to be doing that in the next couple tests after this, but let's go through these first. I'm not going to talk you through the Gillet's test because you've already done it. Seated forward flexion, again, contact with PSIS. Go forward with the motion of the lumbar spine. Assess if the PSIS either stays symmetric or one goes first and furthest. Then you're going to do your ILA exam, prone. Posterior aspects and inferior aspects, and then you'll do your sacral base exam, prone. Don't forget in the seated forward flexion test to also drop down and just check the ILAs while you're there. All right? Okay. Now,